Hola y buenos días. Gracias por estar conmigo para aprender algunas frases en español. Hi, thanks for being with me just to learn a couple little phrases in medical Spanish. Spanish is an amazing and beautiful language and a lot of fun. And guaranteed you know more Spanish now than you think you do. Because of your medical vocabulary, you already know a lot. And that's because English, Spanish, medical often are based in some Latin words that are shared. And so that's a strength for you in learning Spanish. Well, how many times have you been in a situation with a patient you really didn't know what they were saying and it made a difference and an impact in the quality of care? I'll bet you that's happened because as our United States demographics are changing, much more heavily populated by our Hispanic Latinos, we have many patients who don't quite speak English well. And sometimes your Spanish might be better than their English. Well, it's very important to, of course, try and bridge those gaps and be able to communicate because it can make a difference in the quality of care. I was on a step-down unit from open heart surgery, so the patient was transferred to me, and the report given to me was, here was a 75-year-old Hispanic, non-English speaking, disoriented, confused man, post-CABG in 4-point restraints. Good luck with that, Tracy, right? And so I thought, oh, you know, you have this preconceived notion of this is going to be a heavy day because I'm going to be doing total care, right? So I went into his room and in Spanish with phrases that I knew that were simple, said, Buenos días, soy la enfermera, me llamo Teresa y voy a ayudarle. ¿Cómo puedo ayudarle? So I introduced myself. Hello, good morning, I'm Tracy, I'm your nurse. How can I help you? Tell me your name. And he knew his name and could address me. And I thought, okay, well, let's now do a little neuro assessment and see where we are on the confusion level. So I asked him, what is the day? What is the year? Where are you? And he was completely lucid. He knew where he was, what the date was, the year, the month, the president, all of that. And I'm thinking, why did they say he was so confused? Because for me, he's very alert and oriented. So I asked him, why are you in these restraints? And he says, I don't know, but it makes me mad. I accidentally pulled out a tube, and then when I woke up, there was another one, and it scared me, so I pulled it out. And so he was scared, uninformed, and couldn't communicate with the nursing staff. And so he was judged to be disoriented and combative and confused. And so, of course, they put him in 4-point restraints, and he woke up with that, and that made him even more mad and scared and confused, right? So as we talked, then I was able to ask him, if I take off these restraints, would you like to sit up and feed yourself breakfast? Because we had also stripped him of his dignity. So being in a hospital is scary enough, isn't it? Well, then, if you can't understand the language, that's really scary. So it had been a series of unfortunate events that created this really uncomfortable situation. Well, very quickly within the hour, we were able to take off those restraints. He was able to sit up, restore his dignity, be able to brush his own teeth, feed himself, even start to comb his hair while I could still deal with the other monitors. And then I could explain to him, this is what this monitor's for and this tube and all of those things. And so that helped him settle down and be more relaxed during the day. We had a very delightful day. Well, it was a language barrier. So I wrote on a piece of paper some basic phrases, which I'll share with you in a minute, put them up because at the end of my shift, the next nurse needs to know those were there. So when I reported off, I reviewed those phrases with her, and that was going to be a good thing. Well, now 3 days later, when I return, I get the same report, right? 75-year-old confused, combative, disoriented, non-Hispanic, Spanish-speaking male. 4-point restraints? What? What happened? Did he really have a decline and a change for the worse? So, of course, I go right in there, and the paper had fallen down, housekeeping had swept and taken it away. Now there had been so many different nurses that the language barrier was back up like a wall, and the problem renewed. So did that impact the quality of care? Yeah, it did. Now, you don't have to be fluent in Spanish, but you can make some small efforts. And I promise you, Spanish-speaking people absolutely are so grateful for any effort that you make. We might sound like we're speaking caveman talk, I nurse, you patient, okay, amigo, right? That's okay. Because honestly, just the effort that you relay makes such a difference, and they're good for the heart and the soul for both the patient and for you as you begin to understand each other. Now, of course, body language is 90% of communication, and so the way, the tone of voice, your mannerisms, the softness in your eyes can also convey a lot of meaning and caring, and that's a big deal. But being able to say little phrases can be really helpful. Here's a couple of them. Just identifying yourself will brighten their countenance that, wow, you're actually making efforts. So by saying, I am, and then identifying your title is helpful. You say that by saying, soy, for me, I'm a nurse, soy la enfermera. Soy la enfermera. I am the nurse. Enfermera sounds like infirmary. Well, yeah, it shares that same root Latin word. And then an enfermera for a girl, enfermero for a boy, also lets you know that's the person that practices that healing, dealing with sick people. Now, if you're a physical therapist, you would say, soy el terapeuta físico. El terapeuta físico, or I'm the physical therapist. Now, you could even say that part in English, soy physical therapist. Because there are so many words that are what we call cognates, they mean the same in English as in Spanish, they can also begin to understand you. Or just saying soy, your name, I am, and then your name. Generally, we'll say, me llamo, I call myself, me llamo Teresa, me llamo Josie, whatever your name is. You can also say, mi nombre es. Mi nombre es. My name is. That sounds very similar to English, doesn't it? Whichever phrase is easier for you to remember, use that one. Then some other really important phrases are, tiene dolor. Tiene dolor. Do you have pain? Are you in pain? Is what that's asking. Sí or no? ¿Dónde? ¿Dónde? Where? ¿Dónde? ¿Tiene dolor? ¿Dónde? And then they can point. You can always say, muéstrame. Muéstrame. Show me. Right? It sounds like demonstrate. Muéstrame. Show me. Where is that pain? And they can point. Body language, that's absolutely okay. You've been doing it already. But with a couple little key phrases, that's going to help and make a more positive impact on communication. Another phrase that's good is necesita, like do you need water? You know, you can point to whatever it is you think they might need, a blanket, a pillow. You can even say them in English if you don't know the vocabulary yet, but you just have a little word or two or a phrase can be really helpful. Necesita. Now, changing that is I need you to do this thing, to sit up, lie back, or to go to the side, whatever, right? Necesito, yo necesito que usted respire profundamente, por favor. I need you to breathe deeply, please. That can be really helpful. Necesito. And then even if you use the verb in the what we call the infinitive form, respirar, respirar, right? Respirar profundo. That sounds like profoundly, right? See, there's a lot of words that are very similar. So just even saying a couple little phrases, and then you throw in an English word, that's great. So those are just a couple little examples of making some basic efforts in medical Spanish that can be tremendously helpful for you and your patients. So yo sé con todo mi corazón que puede aprender el español. Es un idioma bellísimo. It's a beautiful language. I know you can do it because it is quite similar to English. So with those little hints, buena suerte, que siga practicando. Well, good luck, and I hope you keep practicing. Buena suerte. Hasta luego.